Thankfully.
Yes, I give you all the time adjustment because I know that you're a nice girl. I mean, a very, very nice student, not nice girl, nice student. That's why I give you some all time time allotment or time adjustment. But today I need to go to the post office, and
It's
tomorrow, do you
okay.
know, it's holiday. Do you have like what day?
I have we
Do
have
you have
holiday
that?
tomorrow. Oh,
Yes,
I still
college
have
is
class
having.
tomorrow.
Whose class is that?
Miss Sophia.
I just confirm with her because it's holiday. I mean, holiday is declared.
Oh, okay. I'll just text her and ask.
Mhm. Holiday is declared because on August 12th there is election. No? So
Yeah, on
holiday is
Saturday.
declared. So just ask to her because if portions are remaining, then maybe she wants to take. Just confirm with
Um,
her. Huh?
okay.
Okay. Okay. So what we saw was that it's a light-sided remedy, lac caninum, and we saw that because it is lac connection with lachesis, so many symptoms we can see in comparison with lachesis. Then they have that flying type of pain and the symptom that you remembered that they are very forgetful, buys the things and then forgets it and walks off. They use too many words and thinks that her disease is incurable. And the symptom that the child screams all the time, especially at night. Then so many fears are there that they are alone, no friend is leaving, they will become insane, and the chronic blue condition. The cursing and swearing, as like we saw in anacardium, and then they don't have that grounded sensation, and that's one of the theme we saw in the lac remedies that if they are not properly had a lactation, they don't feel that they are connected to the ground or connected to their root, not just ground to their root. So it will be manifested as when they are walking on air, and when lying down does not seem to touch the bed, and they have lots of scare uh, and also vision of snakes. Then we went to the coryza, the nose affections, where the nostril is stuffed up. The discharge is acrid, and that might be causing the parts or through which it is moving on to become raw, similar to that what we saw in Adam trifilum and Allium cepa. So the throat, the characteristic symptoms will be sore throat, diphtheria, tonsillitis, etc. And the characteristic feature here will be the symptoms changing from side to side almost immediately. So in diphtheria, there will be the common symptom of the disease will be the pseudomembranous deposit. And in homeopathy, when we study, though it is very difficult to remember, I agree. I mean, in diphtheria, we have a lot of remedies, and I told you the reason because when this was written, Medica was written, diphtheria was a killer disease. There was no vaccination. I'm not promoting vaccination, but still, the reason what when I go through the medical literature, what we get is diphtheria was killing children or a killer disease at that time because there was no vaccination. That's the reason I get in the medical literature. So it just came out. And then what else? So that diphtheria, the pseudomembrane formation is a common symptom for the whole disease, but the color may be varying, and accordingly, all our medicines which are suited for diphtheria, we can see they mention the color of the pseudomembranous deposit also, most of the remedies. So here it will be a pearly white appearance, a shiny glazed appearance. Usually it should be a grayish deposit, a white grayish deposit. That's how usually the deposit will be seen. But here, in case of lacanina, it will be pearly white or pure white porcelain. That's the color they say, pure white porcelain. Which is this color? I'm not getting this color, pearly white. One second. More colors. Or it is maybe from here. Okay. What's hmm. Then what? And it will be as we told in the physical, it will be starting in the left side and there will be very much pain, sensitive. The person will be having a constant inclination to swallow, but then it is aggravated by empty swallowing. And it will be very painful, radiating to the ears. And then it will shift its side. It will shift from left to right side, the same symptoms. And then after some time, from the right, it again goes back to left. So this alternation of sides is very characteristic. At that time, they even feel like in sometimes in case of diphtheria, there might be like a soreness, a tickling sensation, cough with sensation of a lump. And this might be the lump also changing from side to side. So in diphtheria, so in conclusion, what you have to remember regarding the diphtheria should be it starts in left side, then it get alternated to right, and then again to left. And that alternation will be happening so rapidly in very less time. It will be as if the pains are flying in nature, then aggravation from constant, no, the will be constant inclination to swallow, and then aggravation from empty swallowing, and that pain will be radiating to ears. And the characteristic color, the pure white porcelain color, because it's very rare to see diphtheria, I mean diphtherium pseudomembrane deposit as porcelain white and all, or pure white. So that would be the color of the deposit in case of lac canine. And for GIT, they have symptoms like it's not that much important. It is very, the people will be very hungry, that they cannot eat enough to satisfy, as hungry after eating as before. So one of our remedy would be lycopodium. In lycopodium also we have that symptom. They have very greediness for food. They want to eat
Mhm.
as sometimes they eat also, but not the same persons, but we can say the lycopodium two constitutions. So one constitution will be very greedy, will be always
Mhm.
having that voracious eating. But another lycopodium will be just, though they will be feeling increased hungry,
Mhm.
when they are taking food, just a few mouthful will be enough, or few morsels, they would be feeling as if the stomach is full because of their bloating sensation. So they also have that hungry sensation, but they can't satisfy themselves. So the same symptoms we have in case of lacaninum also, and a lot of other sea remedies like cascarilla, calcarea carb, cinna, strontium carb, etc. So that symptom will be very important, and that too important because it is having a comparisons, some symptom, I mean lacaninum and lycopodium maybe uh, in your syllabus, of course not, but sometimes even lacaninum and lycopodium could be asked for a comparison, because there are so many, one is left sided, another is right sided. Even lycopodium has got action on throat complaints. Then both are constitutional remedies, so a comparison can come. That is why this sentence was, I put the over because of its comparison with lycopodium. Lycopodium having that similar symptom. But however, if you are going to take lacaninum by its own individually, the drug, then this symptom is not that important. Then in female reproductive system, this is very important. After to the throat, mind, the next important sphere of action of lacaninum will be in female reproductive system. So the menses will be too early and too profuse. The characteristic feature will be its nature of flow or the bleeding. The flow will be in gushes, means that will be profuse. And it will be bright red, viscid and stringy. So this is a characteristic feature, the color, the gushing of the flow that is going in gushing, or in that much force it will be coming out, and that will be bright red, viscid and stringy. So here we need to remember one of the drug which is having almost similar thing. The viscid and stringiness is the only difference is the color of the blood. That will be dark over here, and that is Crocus sativus. But if it is bright red, viscid and stringy, it will be lac canina. And another thing, it's not just this the bright red or the dark red, which differs lacaninum and crocus. Crocus is also a hysterical remedy. It is also having action on mind. So, and also crocus is given for female reproductive system complaints. And because of the common action means not similar action. Common action that crocus has on uh, this one mind and FRS, and also lacaninum having on mind and FRS, and this symptom being similar, somewhat similar, they could be asked for comparison. So have to remember this one, the bleeding nature of the lacaninum. And then they are a good set of remedies for mastitis. So then we can see some of the symptoms are very similar to that what we learned in phytolacca and also bryonia, the symptoms of mastitis. So breast, it will be swollen, painful, sensitive before and during menses. Then breast will be inflamed and it will be very painful in nature. Aggravation by least jaw towards evening. And you might be remembering, I don't know whether you remember, in case of bryonia, this sentence is very important. Must hold them firmly when going up or downstairs. It's a characteristic feature of mastitis where the least jaw is painful for them, so that when they are going up or climbing the stairs or climbing down, they hold it very tightly. And we see that symptom in case of bryonia, and we can relate in case of bryonia that the same symptom, because bryonia wants that total rest. Total rest is the amelioration. The least movement is going to aggravate their complaints. Mastitis per se, it is having movement or slight jarring will be very painful for them who are having mastitis, because it is the inflammation of breast, and the mammary glands with the I mean the lacteal glands, it will be all inflamed, so it will be very painful situation. The person can't endure least movement. So that's how we connect with the bryonia, the total body, any feature or any complaint, they don't want to move about, they want that complete rest, even for their mental symptoms. But otherwise, when we remove bryonia, their feature for some time, we concentrate on mastitis. We see that in mastitis, already movement will be aggravation. So, and understand that difference. Bryonia is all the other complaints also. Bryonia is having that same. They need that rest, complete rest. But in case of we forget that and we just concentrate on mastitis. Mastitis, the least movement or the least jar will be very painful. Anyway, because of that least jar or movement being painful, the person will be holding the breast firmly when going up or downstairs. And another important is in case of the serviceable in almost all cases when it is required to dry up milk. So another remedy in that case will be asafoetida. So there might be some women who would be coming to you for this complaint. Usually, what women do is to use some of the natural remedies or home remedies. Even they may be using asafoetida not as a homeopathic remedy, but the you understood what is asafoetida, right?
Uh,
What we say
it,
for asafoetida. It's a
not
kitchen.
really.
Okay, you got it.
It's no, no, no.
It is used in kitchen, Farah. Asafoetida.
Okay.
It's actually like a
Wait, let me
salt. It's
Google
a
it.
kitchen item. Yeah, because I don't know what it is called over here. It's a very bitter thing.
Oh,
Do you use in? Should be because if
I
it
don't
is,
think so.
you don't use over here.
No, I mean,
Oh,
I in my family don't. I don't think we use it.
wait. Do you make sambar?
Sambar,
Over here you
sambal.
get crochet. Yeah,
Is it? Are you talking about sambal?
it's not sambal. where do you eat toshe? Toshe over here, the Indian restaurants. Toshe,
Yeah, yeah,
you
yeah,
say na.
yeah, yeah.
So
Mm-hmm.
along with toshe, you get one pea curry with some vegetables.
Yeah.
Sambar, sambar. What you say? How you pronounce? Because I just say sambar.
I guess was I'm not sure what sambar is actually. Wait, let me see.
You eat this thing, right? You eat toshe.
Yeah.
And when you eat toshe, what is that? Some additional curry or gravy you will be getting from the hotel, right? What is that thing? What you call for that?
It's not like dal.
Huh? Yeah. Uh, in that dal, they put a bit of asafoetida.
Oh, okay.
That gives a nice smell for that. But if the level of asafoetida is increasing, then
Uh-huh.
the whole the thing, the whole sambar, we have to throw it out because this
Oh,
will become very bitter. Because the
I see.
taste of asafoetida is very, very, very bitter.
Mm.
Mm. So even in Indian cooking, not all I don't know much about cooking, but in my knowledge, it's only in sambar that I have to make every day. Oh, most otherwise we will be making some dishes only for very rare occasions, right? So I don't
Okay.
know any Indian cooking rare occasions they use, but something that is daily cooked in
Mm-hmm.
this dal, we have to use this as a forchida. So in every Indian house, they will be having this as a forchida, and only few we use. Yeah, we use it in some type of fishes also when we are
Mm.
frying it or making fish curry.
I see.
Like we
Okay.
should be very careful. So as a forchida, it appearance is so different. It's actually if you Google, you can see it's actually a gum that is coming
Mm-hmm.
from a plant. So we can get it in the form of a gum, dried gum, or sometimes in the
Mm-hmm.
form of a powder. And if it is powder, we directly cook. Oh, I'm teaching you cooking over here. But if it is powder, we directly put it in. Or we are going
Uh-huh.
to, if it is gum, like we take a small piece and then put it in water and use that water for cooking. That's how usually used. So why I'm saying this? If it is the gum thing, not the powder, the gum thing,
Mm-hmm.
the ladies when they want to stop this breastfeeding after like 3 or 4 years,
Mm-hmm.
then they apply a bit of asafoetida on their nipple area, so that
Oh.
when the baby is going to suckle it, he will
Mm-hmm.
have that bitter taste, and it's so bitter that the baby don't want to drink. And then
Oh.
gradually they stop. So initially there will be tantrums, of course,
Mm-hmm.
but then gradually they stop. So that is a practice usually done in India to stop this breastfeeding. And they're not doing anything, it's just external application. But from the
Okay.
same asafoetida, we can, in homeopathy we have medicines. So asafoetida can be used to require to dry up milk whenever they want to stop this breastfeeding. So we have two remedies to stop this breastfeeding, or to stop this, or to dry up the milk, that is asafoetida and lacanainum. And then we have another medicine to increase the production of breast milk, or once it is stopped and we have to bring it back. In those conditions we can use the medicine lac defloratum. So 2 lakhs are there. I always get confused, but that's why I'm saying you don't get confused. Lac caninum and asafoetida. Asafoetida, now you can remember the way I connected. From that analogy, you can just remember asafoetida will be used to dry up the milk, and lac caninum also used for the same purpose. But if it is to
Okay.
increase, because some people, some ladies, they may not be having enough milk, or sometimes they had for 3 or 4 months or 5 months, 6 months, and then it reduced, it stopped. So in those conditions, to bring it back, we can give lactifloratum also, and it acts actually. That's why I'm giving much importance to those symptoms. Then
Okay.
they may have loss of milk while nursing without any known cause, and that condition we call as galactoria. So this is a good remedy for galactoria if there is a loss of milk also without any non-cause. And even asafoetida comes over there. So in case of uh, lacunainum, the sexual symptoms, you see the importance of the symptoms. They have one action on menses, then we have to say the blood nature, then they have action on the breast, the mastitis, and also related to the lacteal glands. And then they have another symptom, that is physometra, the discharge of flatus from vagina, and which is a symptom that we already learned. I don't know whether you remember, in lycopodium we have seen this symptom when we are discussing. And also bromium. Bromium we didn't take, I think. Uh, these are the two remedies in which we see physometra, but that is also seen over here. Then what? Then sexually, these persons are highly excited. Even the sexual organs, just from touch, pressure, friction, by walking, even that much contact is enough. They will be having that sexual desire. So other remedies in comparison will be cinnamon, coffee, um, coffee. This would be muriatic acid and platinum. Cinnamon, the full name will be Cinnamomum zeylanicum and Cinnamomum cassia, though we don't study it in detail, okay? Because sexual organs, we have many other remedies. So I have not, we just say cinnamon, not even the full name I have learned before, even for MD. It's very rarely prescribed. Then in respiratory symptom, as such, not that important. They have a sensation as if breath would leave her while lying down. They should get up and walk. But this symptom in lac caninum, though it is not important, the same symptom, it is very characteristic in all the medicines that I have put in bracket. Ammonium carb, grindchelia, and lachesis. The feature, if you take lachesis, the connection lac, lachesis over here
Uh-huh.
also. In lachesis also, remember there is a night aggravation. So when the person is lying down, the complaints are aggravating in case of lachesis. So this
Mm.
symptom, that when the person is lying down, the sensation as if the breath would leave her, will make the patient to get up and walk. So the same, this is highly characteristic. This symptom, that lying on the bed, it can bring about breathlessness and the person is forced to move. It is a actually symptom that we see in um, this one. What is that? Pulmonary edema. Yeah.
Okay.
Pulmonary edema, and pulmonary edema we usually have due to heart failure,
Uh-huh.
especially edema over here means it should be the left heart failure. Left heart failure, 1 minute, let us make the connection. Left heart failure, so the blood accumulate in the lungs. Pulmonary edema. And right heart failure, then yes, yes. So it is in the left heart failure. Left heart failure, because the blood won't be, I mean, the heart, left part of the heart won't be able to push the blood to the aorta. It will be getting
Uh-huh.
accumulated, and the back pressure,
In the
and then it
okay.
will go towards the lung. So there will be this capillaries, the small capillaries in the lung area, the pulmonary capillaries will be filled with blood and the fluid. So when the person
Okay.
is lying down, he can't take a proper breath. And this is a condition seen in pulmonary edema or the heart failure, especially the left heart failure. But that condition is actually um paroxysmal nocturnal dyspnea, PND.
Oh, okay.
Yeah. Paroxysmal nocturnal
Mm.
dyspnea. So in paroxysms they come only at night because they are lying down. So they have to get up, or they have to sit in a slanting position. They won't be able to lie down. It's because when they are lying down, the blood that have been pulled, because mostly pulmonary edema, though we say it is due to the left heart failure, gradually within years, because of this pooling of the blood, the again blood pressure comes, and then the right heart is also going to get into a failure condition. So then it goes towards the total heart failure or the congestive cardiac failure. So when it is the right heart that is affected, the back pressure again goes, because whenever the forward pressure, I mean the forward push of the blood is not happening, it is getting accumulated, so the back pressure will be there. So when the heart, the right heart also get affected, then we can see the symptoms or the pooling of the blood in all the vessels, that is of the superior vena cava and inferior vena cava. So in this, if it is the inferior vena cava, the pooling of the blood, which means there will be pedal edema, or the feet, the ankle, the legs, everything will be swollen. So when this person is lying down, when she was mm, sitting all the time, or when she was standing or whatever, the pooling of the blood that happened in the leg, it was not moving towards the heart region because of the gravitation also. But when the person lies down, it is the legs are slightly raised to the level of the heart at least. So the blood from the leg region, it will be getting moving back to the heart region. The movement is easily possible at that time, because now it is not against gravity as like the person is sitting or standing. It's not that much uh, uh, strain that is required. So it will be a workload for the blood vessels. So it will be, the circulation will be somewhat okay, that the blood, the pooled blood in the pedal area, that will be moving towards the right heart. But still, even if it is that blood is coming over there, the fluid is coming, right heart has gone into a failure. It is not able to do that forward push. So what happens is, there is an accumulation of the fluid in the right heart, and the person will be waking up with a this one dyspnea. So this condition, though we learn in lac caninum, and we see here also the heart symptom also, there is palpitation, violent when lying on left side. So that also shows the heart pressure. Heart pressure in the sense the workload on the heart is increasing. So heart of the person, the lac caninum patient, is anyway affected. But this symptom, though, whatever I told the pathology, how I connected, this is more important in case of these three drugs, Rangelia lacusis and ammonium carb. So if a patient is coming to you with these complaints of heart failure and this PND, the
Mhm.
important remedies which you can think of would be these remedies. And here in this grindili is usually given as a tincture. So I wouldn't advise you, but they have that symptom. Lacasis and ammonium carb would be a better choice. And then, but lacanina also have got a similar action. Only that you remember. So this symptom is actually due to the workload on heart or the failure of heart. So in the heart also we can see when the person is lying to left side. So lying to left side means all the whole pressure of the body, everything, it is coming towards the left side, the apex of the heart. So then there will be increased blood flow. That means there will be palpitation. So then the patient has to turn to right. And another remedy will be tobacco. And this we also can connect. We can connect pathologically like this. Even we see that symptom in case of pregnant women. They are also not able to lie on left side. Almost all the heart patients, they can't lie on left side. When they are lying on left side means the pressure is going towards the apex region of the heart, and the fluid flow will be more, and that kind of causes an increased workload. So the left ventricle will try to push. I mean, the blood is coming there, but
Mhm.
it will try to push. It is not able to push forward to push it into the aorta, but it will try to do. And when I tried to do, even though blood may not be going that easily, but because of his excess work strain, the palpitation will be there. So any of the heart medicine, they will be having problem when they are lying on left side, especially when there is a fluid accumulation. And that's the same symptom we see in case of pregnant women also. Though they don't have any diseases in the heart, because there will be already fluid accumulation because of the increasing size of belly. And the pressure symptoms will be there will be strain on the blood vessels, and as a result of that, they also can't lie on left side. So it's a common symptom of heart complaints. So we can
Okay.
see that in case of lacanine. The musculoskeletal system. This one we saw in the last class, the cracking of the jaw, and I moved that position. You connected it to the rheumatoid, or not rheumatoid, sorry, it
TMG.
should be OA, yeah, OA of TMJ. And we have other nice remedies, nitric acid and also rest dogs. But this symptom, the next two symptoms is very important. That is backache. Backache, it will be in the sacral region, that is in the lower back, where there is intense unbearable. And see where I have colored it. The pain is getting extended to right natis and right sciatic nerve, which means this is a very good remedy for sciatica. And here we
Mm.
can, even the next sentence, that is the modalities, you can see there is aggravation from rest and also on first moving. Uh, and that symptom we can see in case of Rustrox. Rustrox is also there is amelioration from continued motion. The first movement, the continuous rest, it is an aggravation for rest dogs. So, but then when they are moving continuously, walking about, then it is an amelioration for rest dogs. And that's how we connected the physical restlessness of rest dogs also. And now how it becomes important is, in case of rest dogs, generally we say rest dogs is a right-sided remedy,
Mm-hmm.
but their sciatica is left-sided in
Okay.
case of rest dogs. And when we see here, lacaninum is generally a left-sided remedy. That's what we learned.
Yeah.
But the sciatica is right-sided.
Mm. Okay,
So that,
understood.
yeah, yeah, that is why it is getting important, that comparison with Rustox also. So the symptoms being same, but what Rustox is being doing with its side, we can see a similar with the lacanine, but only the uh, sides in both the drugs are opposite to each other. Then another symptom is what we see in agaricus, cingamet, chininum, phosphorus, so many other remedies. The spine, which is aching from base of brain to coccyx. So spine will be affected, some spinal neuralgia or spinal degeneration from the brain to the coccyx, and there will be extreme sensitiveness to touch or pressure. So these are the symptoms in the back. And then we have modalities: aggravation morning
Mm-hmm.
of one day and in the evening of next. And also like lacusis, we may have night aggravation. And amelioration is from cold in general, or the cold climate, and also by cold drinks. So that is lacaninum in short, a left-sided remedy. Please remember its action on the mind, the hysterical nature and all, and a lot of comparisons. And then we saw in the throat the diphtheria, the nature of that pseudomembrane deposit, and then what are the aggravation ameliorations over there. Then GIT and all is not that important. Then like canine, the musculoskeletal will become important. The TMJ affection, and then the sciatica, which is right-sided, though the drug is left-sided, and also the spine being sensitive from base of
Okay.
the brain, that is from the occiput to down to the sacral region. And another important, most important sphere of action will be females. Well, we have to mention about the nature of the menses. Then, what are the
Mm-hmm.
affections on the brain, including the mastitis, its service in drying up the milk, and also for galacturia. And another will be its extreme sexual desire or the sexual eroticism just by the contact, or just touch or pressure, that they will be getting excited. So that is with lac caninum. And then we go towards lac defloratum. And lac defloratum is actually the skimmed milk. The skimmed cow's milk is lac defloratum. And here only
Mm-hmm.
two things are most important. It's a very good remedy for headache. The headache is very characteristic. And then for constipation also. So if at
Okay.
all lac defloratum is asked, it will be just meant to mention the head symptoms or to mention the GIT. So you have to go for the constipation. Otherwise, nothing will be asked from lac defloratum. So in case of
Okay.
history, a slight history, the successful treatment of diabetes and Bright's disease with skim milk by donkey was the hint which led Dr. Swan to patendize and prove it. And yeah, they also is it is also given for diabetes when there is thirst and wasting. But we know diabetes already these
Mm-hmm.
two symptoms will be there. It is a common symptom of the disease.
Yeah.
There will be the three poly will be the polyuria, polydipsia, and uh, what is another poly?
Mm.
Polyphagia, increased
Uh-huh.
eating. That are the three symptoms in case of diabetes. And even when the person is having polyphagia, because of the insulin lack and there is problem with the absorption, the muscles will be undergoing wasting also. So though I
Mm.
put diabetes, these two symptoms, it is a common symptom of the disease, nothing characteristic. So we can think of diabetes, but should be very careful. Like it will be more of a disease symptom. We are not going to get characteristic individual symptom. But if you get, you can go for lactifluoratum. But we have a lot of other remedies for diabetes. We don't usually give. Still, they have. Anyway, it was because Dr. Swan got this idea. He had seen some physician, Mr. Donkin, who was treating diabetes and Bright's disease with this. And as far as I remember, there is no action for Bright's disease in our proving. Just let I go down. This is dropsy. Or maybe there is dropsy, which is not that characteristic. Otherwise, in what is it? The complaints of like the Bright's disease or the glomerular nephritis, they are not having any much symptoms. Glomerular nephritis means there should be hypertension and hematuria, but that is not the only will be that edema that is formed or the dropsy. Otherwise, no. Anyway, when Dr. Swan potentized and proved it, he saw that it is having diabetes. But still, we give it very less for our medication. Then every symptom that we got via proving has been verified in the cure of the sick. In the characteristic symptom, we see that there is, this is important, okay, what we say here. The drug, it can be asked as an MCQ, like the same single sentence. Disease with faulty and defective nutrition with reflexive actions of nervous center. There is defective nutrition, faulty nutrition, and that is causing some affections of nervous center. That is the characteristic feature of lactifluoratum. So that single sentence can be asked as a MCQ. The nutrition is perverted, so there will be loss of weight, or sometimes it will be even the obesity. So malnutrition is the, it can be overnutrition or undernutrition. Anyway, there is some defective nutrition, and that is going
Okay.
to affect the nervous centers. Great restlessness, extreme and protracted suffering from loss of sleep. Not that important. We have what we put over here in this bracket itself is very important medicine for this complaints.
Mm.
It is coculus and nitric acid. Feels completely exhausted whether she does anything or not. Great fatigue when walking. Then sensation as if cold air was blowing on her even while covered up, as if sheets were damp. And this becomes important because this is the symptom of the patient. Whatever we said before to that, it were all the symptoms of a disease, like some defective nutrition, means a malnutrition. Whatever be the cause, maybe it is an individual cause or a genetic cause, whatever that so we could connect it to some of its disease condition, and that resulting in over or undernutrition also possible. But this is when we say sensation, what the patient is feeling, that becomes a characteristic symptom because it is not a disease symptom but patient symptom. So any, by this much time you should be knowing when a patient is coming to
Mm.
you and the patient is saying you such a sentence, as if she is feeling a cold air, even when she is covered up, and she is feeling like the sheets on which she is lying all are damp. That single sentence is there, and then you see the patient is having a diabetes or some um, osteoarthritis symptoms or any symptom, then you can think about lactifluorative. So that's why I put that in purple color, because it's a symptom of the patient, that characteristic sensations.
Okay.
There can be fatty degeneration, and fatty degeneration is also connected to the faulty nutrition. And in mind, not much important. They don't care to live, has no fear of death, but is sure he is going to die. But this other symptom, globus hystericus, is very important, because in lac caninum also we have seen that globus hystericus nature. They have also hysteria. They have also like a lump is coming from the stomach area and getting obstructed in the throat region, and that is not like a organic lesion. It's just a thought in them. Something it getting stuck in between the neck region or the throat region. So that hysterical nature that we saw, or very characteristic in lac caninum, we see in this one also, lac defloratum also. Sensation as if a large ball is rising from stomach to throat, causing sense of suffocation. And now the part I told you, the head. The head symptoms of lactofluoratum is very important. And I have
Uh,
seen this medicine being prescribed for that complaint, and I have seen relief also. But how do they select usually is they go at that time for the general constitution, whether the patient is having some type of nutritional complaints or not, whether the patient is having diabetes. So if the patient is having diabetes and along with that this characteristic head, then we can give this medicine for diabetes. Otherwise, a patient come to you with just the complaints of diabetes mellitus and you are not getting any other symptoms, there is no meaning in giving lactifluoratum. So you should be very sure what are the symptoms the patient is exhibiting. So here we have the headache, which is American sick headache. And when I say that, do you know what is American sick headache?
oh no.
That's a term that is used to indicate migraine.
Oh, okay.
So earlier, now what when we saw was Bright's disease, which is
Mhm.
actually now we use the term
Blueberry.
glomerulonephritis.
Yeah.
And another term which now which come to my memory now is phthisis in veterinary medical. And actually, the term now we use is tuberculosis.
Okay.
And this one, American sick headache, that term earlier used now indicates migraine. So this is a very good remedy for migraine. And this migraine, it begins, and now all symptoms will be that of migraine. Okay, all the symptoms. You know how the pain of migraine will be. Don't look at the document.
Oh,
You know
just
how.
like I know that it's like half of the head. Just like
Yeah. Yeah,
yeah.
half of the head will be numb, and they will be extremely irritable. Even the light or any type of external impressions, the light, the
Mhm.
noise, it is going to cause them big trouble, and they want to lie in a calm, peaceful, dark area with no voice at all. And mostly they will be finally having, or the attack will end with a uh, the attack will be almost always associated with the nausea, and then when the patient vomits, patient will be having ameliorate. So that all are features of migraine itself. So same thing we can see over here. So if you understand it is the and if you remember American sick headache means migraine, then everything else you can fill it off. Only the characteristic symptom will be here in case of lactic fluorator, it begins in forehead and then moving towards the occiput. And we have also remedies from the occiput it starts and then come to the forehead. Gelsemium is one, and then we have remedies. It comes from the occiput, or it starts from
Mhm.
the occiput and then come and settle in the right eyes, and that is sanguinaria and silesia.
Mm.
So in this remedy, like the flodatum, it starts in the forehead and then it
Mhm.
is moving towards the occiput region. So that's the only sentence you have to know All the other symptoms are that of migraine. So here the pain will be in morning on rising. Usually the people get up with that migraine. There will be throbbing pain, nausea, vomiting, and blindness with obstinate constipation. Obstinate constipation, that's a characteristic symptom in case of lac defloratum patients. Okay, usually it's not seen in migraine. So for migraine, we have other remedies like sanguinaria, iris versicolor, which is a very good remedy, and also epicea. These are the common remedies given for migraine. Then the patient will be having, as I told you, all the external impressions, aggravation from noise, light, motion, and also during menses associated with great prostration. And amelioration, the patient wants pressure or to tightly bandage. So if you have seen any migraine patient, they will be having almost all the symptoms. They will be tying up or wrapping their forehead region very tightly, and then they go to sleep in a dark area. So here also we see the amelioration by bandaging head tightly. We see
Mhm.
that in Arsena nitricum and pulsatilla, and there will be also copious pale urine during the pain. Uh, and this symptom we can see in another drug, that is gelsim. During the headache, there will be copious pale urine. And another one drug, we see the same symptom or urination giving amelioration. When the patient is having such a headache, if a
Mhm.
copious amount of urine is passed, then there will be amelioration. We can see that symptom in case of sanguinary also. Copious pale passage of urine is amelioration. Okay, confirm sanguinary. Because there are two remedies, sanguinary and silesia,
Mhm.
and both of them they have a headache that is almost similar. But I think the urine amelioration is in sanguinaria itself. Cannot see here, but anyway, it is not in silesia also. But this symptom is given in comparison somewhere else. The first urine is amelioration.
Mhm.
Ah, see, when you say you, I just get confused. It is in silesia, profuse
Oh,
urination amelioration. I'm sorry.
so it's not in sanguinaria?
No, it is in silesia. So the same symptoms in case of headache. I always get confused. Hmm. Especially the right, that is criteria, and narration pressure and warming up, and narration profuse urination. It's not in sanguinary. Okay, I'm sorry.
Okay.
So with the same symptom we have in case of leg decoratum also. Most of these symptoms are characteristic feature of migraine. And if you take the headache of sanguinaria and silesia, have you learned these two drugs? Silesia,
No,
I just
but I
the other
took
way.
sanguinaria.
If you take the migraine or the head symptoms, you
Mhm.
can see most these three drugs that we told discussed now: silesia, sanguinaria, gelsemium. They all have almost similar symptoms. So then, in case of GIT, this is a good remedy. This is another condition. What we told earlier was headache. It can be given, and then another condition is lactic fluoratum. We also have rheumatism. No, lactic acid. Sure, it isn't. All the drugs are so, so, so. Okay, in GIT, this is a good remedy for the
Uh-huh.
bitter water of pregnancy. What is this bitter water of pregnancy? Vomiting of bitter water of pregnancy.
It's like water brush. I don't
Yeah,
know.
water flash, but the morning sickness.
Oh, okay.
Pregnant ladies. So it is almost as specific. Morning sickness is a common feature in case of pregnant women. So
Yeah.
when they are coming with this complaint, usually don't touch it because it will go by its own. But if at all you want to give, the one medicine that I have been mentioned over here, lactic acid. Lactic acid is more than useful than lactifluoratum when we
Okay.
are going. That's why I went down and not, I mean, to the lower portion to see. And here you can see that morning sickness I have given in green. Though I have not given, okay, because morning sickness and all is a common symptom. That is a common feature of pregnancy. There is no need to take any medicines. Just
Mm-hmm.
give placebo, that's it. But make sure that there is no much fluid loss from the body. Um,
Okay.
so, so in GIT, we can also the lactic acid, lactifluoratum, we can see that common feature. There is a vomiting of bitter water during feast, during pregnancy. Then first of undigested food, intensely acid, it doesn't matter. I just put it. But the constipation is very important. There will be ineffectual urging, like anacardium amax vomica. There will be increased urge to pass stool, but it won't be successful. That's what ineffectual urging. The feces will be very dry and hard. Stool will be large, hard, with great straining, and it lacerates the anus and produces extorting cries in the patients. So that is the feature of constipation. If a patient is coming to you with very intense constipation, where the stool has not moved for so many days,
Mm-hmm.
and the patient has a urge or a desire to pass stool, but the stool is completely dried up and very large in size. And if it
Mm-hmm.
is very dry and large in size, then definitely when it is going to pass, or the patient is trying to evacuate it, it will produce certain cuts or lacerations in anal region, and that will
Uh-huh.
cause intense pain. The extorting or that extreme kind of cries it can produce. So that is the characteristic feature of lactifluoratum. So this lacerating anus with that intense cry, if we get, we can think about lactifluoratum. But then we have a lot other remedies also. We have the silesia, bryonia, opium, chelidonium, lycopodium, plumbum.
Mm-hmm.
All these are other remedies for constipation, which is highly active. So lactifluoratum we don't usually give, but some people, when we think of this medicine for constipation, though I mentioned the symptoms, some people, when they take milk, it is very difficult for, it causes some stomach trouble. Sometimes they may be having
Yeah.
constipation also. Yeah. So in those people, when we get the symptom like this, people have complaints from milk, then we can try lactofluoridation. Otherwise, there is a list of remedies, other remedies which we should think of, or which has been given and it is proved, reproved, verified. You can see that. So when we have confirmatory medicines, we don't go for these rare remedies. So when we are going for rare remedies, we should have that characteristic feature. And here the feature will be the constipation is there, but it should be somehow related to milk because it's a lack remedy. So,
Okay.
this case, I would say J.H. Clark, I would have referred from. So, a woman had taken 10 to 12 enemas daily. In some cases, 1 to 2 will be due, but the lady had taken 10 to 12 enemas per day, often passed 4 or 5 weeks without an evacuation. So, stool, even then, 10 to 12 enemas per day, and then 4 or 5 weeks without an evacuation. I don't know how she survived even for 15 years standing, the constipation, and that was cured with lactifluorature.
Okay.
Then in female reproductive system, not so characteristic, but here, like pulsatilla conium, we have the menses that is delayed suppressed by putting hands in cold water. Drinking a glass of milk will promptly suppress flow until next period. I don't know how it is happening. Maybe the patient is very sensitive and hence the action happens. Anyway, this is not that important. That's why I just put it over here. Then there can be also dropsy from organic heart disease or heart complaint, liver complaint, albuminuria, or can be due to some kidney diseases, and also following intermittent fever, which is actually malaria. So malaria,
Uh-huh.
the uh, malaria which is caused by falciparum, Plasmodium falciparum, it can be so severe that it can affect the internal organs, especially the Algid malaria. And in Algid malaria, it is the GIT that is affected. So, following to intermittent fever, which means where the organs are affected. So all the organs, in case of heart or liver or kidney, or following to any intermittent fever, if the patient is having dropsy, then we can give the medicine.
Okay.
So here also, when we say this dropsy, we have seen something similar of it in lactanine. So we see that common feature in lactanine. Also, I told you when the patient is lying left side, the problem complaint comes up because of the pulmonary edema, which means
Mhm.
due to the heart failure. And here also that lac caninum's nature, in somewhat varied degree, we see in lac defloratum. All the main organs, when it is affected, that can cause fluid retention. So if that results in dropsy, they say lac defloratum. But I would say when it comes to practice, this we can study in theory, but when it comes to practice, should be very sure that it is lactifluoratum. So patient is in case coming to you with dropsy, like she's having this ankle swelling or pedal edema, and then you are taking case and the patient is saying that she is having PND or the symptoms of heart failure, blah blah blah, and you don't get any other characteristic symptoms, but you get just this sentence, the characteristic sensation and the as if the sheets in which she is lying upon there is dampness. If she is mentioning, then you can think about whatever. If you get that sensation and then followed by any other complaint, you can definitely go for lactifluoratum. Otherwise, for dropsy, no, we have a lot other remedies.
Okay.
Then, in case of lactic acid, it is the sour milk or the curdle milk that is being used, not the curd, but the milk that has got curdle, the sour milk that use. So
Mhm.
here it is used for okay. Here it is used for diabetes mellitus plus rheumatism, and also in case of morning sickness. That's what I told in lactofluoritum. Also, there is morning symptoms, morning sickness, but it is more important or more specific in action will be lactic acid. If at all you want to give some medicine and you don't get
Mhm.
any other characteristic symptoms, then we can think lactic acid more than that of lactifluoratum. And lac defloratum, we saw that this is a good remedy for diabetes mellitus, and especially that diabetes mellitus is associated with wasting and also intense thirst, which I told you is common disease feature. But
Mhm.
here it is diabetes mellitus with rheumatism. And in homeopathy, mostly the tinctures. Lactic acid also we don't give 30 or 200, we give lesser potencies. It's like 3x and all. So there are some remedies in which we study tinctures, especially like diabetes mellitus with something else. So that used to be a kind of viva question for us. Whenever it is coming up, I will mention. So here it is diabetes mellitus plus rheumatism. Then there are remedies like diabetes mellitus plus skin complaints, then
Mhm.
diabetes mellitus with dropsy. So many combinations are there. Like with according to that, our medicine also changes. So for now, you in lactic acid just concentrate on this. It is diabetes mellitus plus rheumatism. Then morning sickness. So here also, as you told, there will be salivation, water brush, nausea, especially in pale, anemic women. Troubles in the breast, pain in breast, enlargement of axillary gland, and pain extend into hands, which can indicate cancerous condition. And of course, because the cancerous condition is dealt by acid remedies. Acid can cause destruction of the body part concerned. So maybe the patient is having cancerous condition, but still we have a lot other remedies. So we should be very sure when we are giving lactic acid. This can also be given for the tuberculous ulceration of vocal cords. So, tuberculosis, you might be knowing that tuberculosis can affect different parts and organs of the body.
Yeah.
It's not just lungs. From brain, I mean,
Bones.
head to foot, any organ can be affected. So, if the
Yeah.
tuberculosis, I mean, deposit or the tuberculosis of vocal cords have been seen with ulceration, we can give lactic acid, and that's also that acid part in it. Then diabetes mellitus, there will be thirst, voracious hunger, which is common symptom, large quantities of urine that is passed frequently, and with saccharin or urine will be with sugar.
Urine.
Yeah. Um,
Okay.
I Probably they had a heading under urinary organs, and I just copy pasted at that time. I didn't notice that the urine I didn't type. So this is about the diabetes mellitus. But in short, though I didn't mention you anything about the musculoskeletal symptoms or the rheumatism, as such it is not important in case of lactic acid. But the patient has got diabetes mellitus plus some rheumatic complaints, then we can think about lactic acid. Then the another remedy in this list is saccharum lactis, our common SL, sugar of milk or lactose. So even this has been proved. Okay, so when we go to our pharmacy, we can get medicine. Like when we say SL, usually they are going to give us SL, but we can get SL3X, 6X, the actual potentized, even 30, 200,
Oh.
etc. Yeah. So it is the SL. When we say SL, it is our the vehicle, the medicine, the vehicle that is used to give our medicine. But we can get its potentized form also. So these features are from its potentized form. Otherwise, don't get confused. Otherwise, what you learned in pharmacy is the correct one. The saclac, the vehicle, it is actually inert. It doesn't have any medicinal value. If the medicinal value has to come up, we need to potentize it. So this was potentized. When we study it under like this as a medicine, you should understand it is not the vehicle we are studying, but the potentized one. So here it has got diuresis or amblyopia, but most important symptom will be this, the cold pains like a frostbite, as if produced by fine icy cold needle with tingling sensation. The common sensation that we feel when we are exposed to extreme coldness, that ice cold needle things being piercing or just uh, mm, our body or something like that needle like sensation. And this one is more common in case of agaricus. Agaricus, it's a good remedy for that. So though I have given you two symptoms, another symptom is sugar of milk in large doses is used to develop the bacillus acidophilus to correct the putrefactive intestinal conditions and also constipations. However, I wouldn't say you to study this drug. This you can simply uh, you can simply ignore this drug. Just you understand that saclac potentized form is also present.
Yes, can you hear me?
Yeah.
Okay, I'm back.
So what I was saying is in saccharum lactis, though we see this frostbite, it is a good remedy for that. Diuresis condition, amblyopia, and also to develop some good bacteria, the Bacillus acidophilus, so that it can correct the putrefactive conditions if happened in the intestines, and also for constipation. I would never say you to study this remedy. Only understand because we rarely give it in a potentized form. And for these conditions, as we told frostbite, we have other remedy like agaricus. And then for the putrefaction that is happening inside the intestine, you can think for other acid remedies and also um, ourself carbohydrates. So we have better remedies for that, and for that you don't have to remember some rare remedy like SLNO. So I would never say you to study, but because it is in a syllabus, I just put the symptoms. Then we have the lac vaccinum. This is also of not important. There is, I'm just saying you for the sake of your syllabus. So lac vaccinum, there is headache, biliousness, rheumatism, constipation, all the symptoms which you studied here, there in the lac remedies. The keynote of lac caninum is alternation of sites, whereas in lac vaccinum, the symptoms appeared in both sites simultaneously. So that might be the only one, if at all, you have to remember. There will be great thirst and excessive flow of urine, which suggests diabetes, which in short means a lot of lac remedies could be indicated, not could be indicated in diabetes. Then, in case of lac vaccine flows or the cream of milk, we can give it for diphtheria, sore throat, leukorrhea, and menorrhagia. Most of these drugs, if we check, we don't even get its symptoms. But though in the last class I gave you one of the link, one of the link uh, to go to the Rajan Shankaran website. In that website, for every medicine that I have mentioned over here, they have given a personality, their mind features, etc. If you are interested, you can just go through their website. Otherwise, no need. If it is an exam basis, I'm never going to ask you. Maximum I will ask you will be lacaninem and lacdifloratum alone.
Okay.
All these things I'm not going to ask you, but it's out of desire. Like I told you, I don't even know where you will get these medicines. So there is no
Okay.
meaning, yeah, there is no meaning in studying the symptoms when you don't even get the medicine. So, but you can go because I saw in that website the link that I have given you in the last class. A lot of drugs, personalities being described. So if you just want to see, just go see, um, and whatever you like. Then lac vaccinum butyricum taken from the butter, and that is in their syllabus, in your syllabus. But I didn't get a textbook in which I could get some symptoms about this drug. So not mentioning. Then another one in your list was lac delphinum, which is taken from the dolphin milk. And here you will see that is patient is having clairvoyance. Clairvoyance means they will be making prediction about the future. There will be play and pleasure, at the same time separation and detached, which shows its contradictory nature that we saw in the introduction also, because the lack, it is coming from the animals. According to Rajan Shankaran, they believe in this contradictory nature. So we can see that in lac delphinum, the person is very calm during dangerous situation also. But nothing characteristic that which you can prescribe the medicine. That is how. And when it comes to lac felinum, which is from the cat, cat's milk, mostly cat's milk. Okay, there is something. Okay, so there is something that if you even if you want to learn, there is something because the symptoms are all concentrated in eyes. There is ciliary neuralgia, which is aggravated lying on left side. There will be photophobia, asthenopia. This photophobia is the to natural and also artificial light. aggravated by reading or writing, uh, general lassitude, loss of appetite, constipation produced by the drug. Leave it off. I don't want all these symptoms. Just remember this symptom. There is constipation also. So all the lac remedy they are having action on GIT with constipation and then also diabetes. Then there can be pain from the vertex down to left eye. So from the vertex to the left eye and to temple. The pain, that headache is very intense, excruciating, so that the patient runs from room to room. So only the eye symptoms, the photophobia for even the artificial and natural lights. And then the complaints like ciliary neuralgia, asthenopia. So this will be about the LAC group. Do you have any doubts?
No.
Then we continue with our next section. Uh, for that was I need to stop sharing. I can go. Okay. When did we start our class? 11 o'clock.
Mm.
So half an hour more. So we go towards the spider group. Spider group also, these are the medicines that you have to study, like which is there in your syllabus. So we have medicines like Theridion curasavicum. We just say Theridion, but you should know the full name of actually, okay? But we only say Theridion usually. Then Mygale lacidora, Latrodectus mactans, Latrodectus catipo, Tarantula hispanica, and Arania diadema. So these are the medicines that has been put into your list, but the one in italics I have added for by myself, even though it is not in your syllabus. But this is a very therapeutically important medicine because this is a very good medicine for boils, carbuncles, furunclosis, all those conditions. Wherever there is septic conditions or the septic inflammations that is formed in our body. So Tarantula cubensis is a good remedy. Like that, our Arsenicum album. So, and also lactasis. In that same grade, another one will be the same complaint, anthracene. So that is why, even though not in your syllabus, I felt like in your practice also you need to know this remedy. It will be very helpful. Some remedies, it is Latrodectus catipo. I don't understand why you are learning because therapeutically also it is not that important. Mactins is important, but Catipo I don't know. So that is why I just put, even though you don't ask me why did I put that question from my part when it is not there. Because all the other remedies like Catipo and all, I don't know what is its use, but you need to know Tarantula cubensis because this will help you in your practice. So that's why I just put it from my part. And other remedies, which is belonging to the spider group, and that you don't have to learn this one, Arania sinentia, Arania ixobola, Latrodectus hasselti, and Tila arania arab. Out of this, all these are from the spiders, okay? All the first to 10 are from spiders. But Tila araniarum, you know what is the source of this Tila araniarum? Farah, are you there? Can you hear
Hear me?
me?
Yeah, I can hear you. Can you hear me?
Yeah, yeah. So,
Oh, okay.
do you remember from pharmacy what is the source of this Tila arania? Confirm with the spelling because the spelling and the way I pronounce it's not matching.
Tila.
Have you studied this spider group in pharmacy?
No, I I have never heard of this. It
This drug,
says cobweb.
that's no problem. You googled in between.
Yeah.
I just wanted to know, but I'm not sure about its spelling. That's what I'm searching for. This is how I pronounce. That's not the way how it is written. It is from the corporate because all the other remedies that you see over here, it is from that direct spider. All the medicines. But this one, Tila, it is taken from the cobweb actually. So used to come for our MCQs, the Tila. That's why I asked. Oh my god. I'm not seeing the drug over here also in body. How it is possible. Tila areniarum. Arenia. Tila arenia. Okay, so these are the remedies we have 11 remedies, and the last one, Tila areniarum, belonging to the or it is taken from the copper. Then, if we see for the scientific classification, the domain is Eukaryota, kingdom Animalia, phylum Arthropoda, subphylum Chelicerata, class Arachnida, and clade Tetrapulmonata and order Arania. You don't have to remember anything of this, no problem. But because of its importance, you should always remember that the spider it belongs to the group Arthropoda and spider Arachnida or Arania. Either two of this, I mean, any one of this you have to remember. Either that it belongs to the class Arachnida or the order Arania, that you have to remember. Otherwise, no much importance. It just show how it is being classified. And then under the order, there is suborders. There are two suborders, Mesothele and Opisthothele. And Opisthothele is again divided into two, Megalomorphae and also Araniomorphae. So we have lots of mosquitoes over here. And this one, when I saw, I felt like it is like a beetle.
It
Then,
looks like a ladybird. A ladybug.
like yeah, ladybug. Even this one.
Oh
This
yeah.
one is feel like an insect, but these are they say it's spider. So yeah, spider maybe. Then etymology, the word spider it derived from Proto-Germanic word which means to spin prawn or literally spinner because they are spinning that cobweb, a reference to how spiders make their webs. So from that word, the spin prawn, which is a Proto-Germanic, the word spider originated. Then in the animal group features, before we go into the feature, the homeopathic group features, we just see about the animal. The spiders, it belongs to the order Araneae and they are air breathing arthropods. They have 8 legs, chelicerae with fangs, and that is generally able to inject venom and also spinnerets that extrude silk. So, chelicerae is this one via which venom can be injected, and spinnerets will be this part from where the cobweb is made. Then they are the largest order of arachnids and rank seventh in total species. Doesn't matter. The spiders are found worldwide in every continent except for Antarctica. Did I make a spelling mistake with Antarctica? Is it spelling correct?
Antarctica. Oh, there's no C there. The C,
And still it didn't show me.
the C in front
No.
of the T.
Yeah, there is
Yeah, Miss, can you hear me?
Antarctica.
Miss, can you hear me?
Different. Huh? Yeah, yeah,
Oh,
I'm
oh, okay,
hearing.
okay. All right,
I'm
all right.
hearing. But there is C in front of T. Oh my God.
I thought there's no C in front of the T.
It is there. Just Google.
Antar. Oh, now I know.
Yes,
Okay.
please say silent over there. And that's what I was thinking because otherwise it will show the red color.
The red, yeah, yeah, yeah.
And I was thinking why Google didn't recognize because the underline came and then I was pronouncing word by I mean alphabet by alphabet and oh my God, sometimes it's very late we discover the spellings. Anyway, we don't have the spiders in Antarctica. So as of August 2022, we have about 50K spider species, which is distributed in 132 families. And out of this, only small number is said to be dangerous, and only 30 have been responsible for human death.
Oh,
Mostly, it will be, I would guess, in Australia.
yeah.
Well, the most dangerous and poisonous venom of all spiders will be Latrodectus mactans. Its venom is 15 times more potent than that of a rattlesnake. And when we see also, we see when we study the symptomatology, we'll see that Latrodactylus mactans is a good remedy for uh, this one, angina, our heart attack pain. It is a very good remedy, Latrodactylus. So even when we come out, that is homeopathic. Otherwise, poison-wise also, Latrodactylus is the most dangerous. And what would be the symptoms? This is usually neurotoxic in nature. Respiration will be labored. There will be hyperthermia and may cause paralysis, muscle cramps, and also severe pain. There is arachnophobia, which is a specific type of phobia which is very commonly seen, having fear of spiders or anything reminiscent of spiders, not just spiders, but anything that can remind them of their spiders, such as webs or spider like shapes. Are you scared of spiders?
No, I'm
Oh, very
used to
good.
it actually. We have like big ones in Glanton. Like the size of a palm. Yeah, my brother used to catch them for fun.
Oh, you have a bigger sized one in Kelantan.
Yeah, yeah.
Oh, okay. So you're scared of that bigger one.
Oh, no, no, I'm not scared of them because I'm quite used to them.
Okay.
Yeah.
Okay, okay. So, but there are many people who have this arachnophobia. And it shows
Yeah.
that, yeah, 50% of women and 10% of men show symptoms of this arachnophobia.
Are you scared of spiders?
No. No. But if no, I'm not scared, but
Uh-huh.
that is a general reaction. Uh, if that spider was there on just top of me, and then it
Uh-huh.
suddenly fell on my body, yeah, I'm going to get scared. But that's a
Yeah.
normal human reaction.
Yeah, yeah, yeah.
The response suddenly from any type of danger. But otherwise, no, no. Even I used to kill.
Oh, wow.
Sometimes, yeah. Sometimes I kill, and my mom says, "Don't." Have you seen the pregnant spiders?
No.
The pregnant spiders underneath their main body, they will be having something white colored like.
Oh, okay.
Even them, I kill. I don't like them. I mean, it's not fear, but I don't like their movement, their big size when they are moving, and so I just kill them. It's very difficult also. They may come to our body, but as such, I don't. I'm not scared. I don't like. That's it. I'm scared of snakes, but this one I
Oh,
don't like.
okay.
Then this two divisions we have seen above somewhere we were classifying. So Araniomorphae or dynamons are the spiders which have one pair of lungs, and they are usually seen in the air like spinning the cobwebs. And then there is another variety of spiders which are seen in the funnels, tubular holes in ground, and they are called as megalomorphae or tetrapneumons, and as the name indicates, they have two pair of lungs. Just not so important. I just put some animal feature also. Most species belong to the Araniomorphae, and they're called as true spiders or tarantulas. Now, some history about the Arachnidae group, and this is a story uh, told by Roman poet Ovid, in which he says that Arachne is actually a Lydian girl who challenged the goddess Athena for a weaving contest. So Athena is also known as the goddess for weaving. And this Lydian girl, Arachne, she was very much smart, and she challenged this goddess for the contest. And in the contest, actually, Arachne, the girl actually won, and Athena, the goddess, she got jealous and she destroyed what that tapestry, that thing, ultimate thing that they made out of that weaving contest. And out of sadness, this Arachne hanged herself. And in an act of mercy, Athena brought Arachne back to life as the first spider. So this is a story that I saw in Wikipedia, okay? But there is another story that I saw. It is almost similar that this weaving challenge happened. The Arachne was actually a girl, and she challenged goddess.
Yeah.
And then they had this competition of weaving, and in the competition, as they say, it is the girl, the Arachne itself, who was won or who won for the thing. And the goddess Athena, she got angry, and she actually killed the girl. Here we are seeing that the girl committed suicide, but it is not like that. That one, it is told that Athena, she killed the girl, and then out of some sadness or something, or she wanted, wait, she didn't kill also. She cursed her to become a spider. No, Athena didn't kill. In the
Oh,
contest, yeah, in the contest, the girl won. And Athena got jealous, and then she cursed the girl to become a spider, and cursed like you spin for your lifetime. So it is she who made the girl spider. That is one version of the story. The second version is that the girl committed suicide and Athena converted her to a spider. Anyway, Athena brought her or made her as a spider. So whether did she commit suicide or whether goddess Athena cursed her to become a spider, there is not sure. Anyway, the lady, a girl, got converted to a spider. So that is some story related to that. In some cultures, spiders have symbolized patience due to their hunting technique of setting webs and waiting for prey, as well as mischief and malice due to their venomous bites. So maybe as a uh, symbol for patient, because they spin the cobweb and then they are waiting. They are not going for prey finding. They are sitting in their home,
waiting.
in their pleasure, yeah, and then waiting for the prey to come. And obviously the prey is coming. Otherwise, all like all other animals, they are not going in search of food. They're just sitting and waiting. So that's why they, in some culture, it has been symbolized for patience. And also they are very kind of deceptive in nature. It's not direct attack. They're waiting for them to come, and at that time you can see they sit like as if they are dead, total calm or silent. And then when the insect get entangled in that web, then they suddenly sprang upon that insect and they eat. That's how their feeding nature is. So they're very mischief and also malicious with venomous bite. Then there is a dance, which is Italian dance, which is called as tarantella, and it is a dance to rid the young woman of the lustful effects of a spider bite. This I have seen some history in J.H. Clark that was given under the drug tarantula. I thought I will say you this story in tarantula, and I think homeopathically also he got that symptom. So Italian tarantella means it is a dance form, the tarantella. If the woman or anyone who is getting that bite of that spider, then they will be having this dance. Uh, s- Not dance. That dancing will give an amelioration for the venomous effect of that, not the, yeah, the toxic effects of that venom, the symptoms that is produced in the patient, that will be ameliorated if she is dancing very violently. And the same we can see in homeopathic therapeutic also. When we go to those symptoms, we see dancing or violent movement is much amelioration for these patients. So, in the previous centuries, when the persons were bitten by these spiders, they had some symptoms, and here they are mentioning they had the lust symptoms. And we can see when we go towards the homeopathic part that these drugs they have sexual erethism, violent sexual erethism in both males and females. Females may show nymphomania also. So to reduce that symptom, they were made that lady, the patient, to dance very violently, and that dance was called as tarantella. And that's how either the spider or the dance got that name tarantella. Because earlier we saw that it's a name, the true spiders or tarantula. So I need to read once again who got the name, but it is related to that. Like whether the dance name came from the spider tarantula or is it the dance form tarantella. From that, the spider was given the name tarantula. That I don't know. I'll check and see you in the next class. But anyway, this dancing performance was done in those centuries to reduce its venomous effects. So now from the animal part, we'll come to the homeopathic part. Animal part is just for you to read and forget. Just
Okay.
read, that's it. And it's not that important. So in case of constitution, we start with the constitution. Generally, these people will be tall and slender like that of phosphorus, very restless, very nervous, hypersensitive, quick and agile, very alert people. And you know that is the basic nature of actually the spiders, very quick and very alert, having colorful personalities with artistic traits and also very active in nature, not lazy. So when we read this, the constitution, what will come in our mind is actually a phosphorus. Even
Mm.
phosphorus, if you remember, they are also very tall, slender, slim, very delicate in nature. And this nervous complaints is the hyperesthesia or hypersensitiveness is the extremely affected by least change in the sensations. Sensations means any external impressions, the light, noise, etc. Everything they are going to affect, and they also are very quick and alert, very intellectual, very attractive persons. Um, and I don't know whether did you study phosphorus. It is like the phosphorus when it is opened, the phosphorus gas it will be getting spread. So like that, the people will be they're extremely extrovert. They are going to a party, and even if that party they don't know anyone in that party before they attended, they will be leaving out after impressing everyone in the party. So that's a kind
Okay.
of yeah, the charisma, the colorful or the attractive personality they have. So this and even artistic, they are also artistic in nature, quite active. Even in the thermal sphere, phosphorus is chilly. These remedies are also chilly. Diathesis, phosphorus can also be given for bilious complaints. Cancerous, of course, they also have hemorrhagic complaints and cancerous diathesis. Yes, mostly the bones will be affected. And miasm, in case of phosphorus also, it is also all these miasms. So it's a trimiasmatic, psoriasis psychosis, and now the combination tubercular. So the constitution of our spider remedies and phosphorus go hand in hand. I can't even find out one symptom that has been mentioned here which is not present in phosphorus. So the constitution matches. So what it gives a clue is when you come for practice, you shouldn't be confused. Because constitution, we generally tend to think about phosphorus and we have all these things. But at the same time, remember these patients can belong to the spider group also. They're having the same constitutions. Then ailments from so many ailments from the external things like music. Even dance is giving them amelioration, violent movement, but music, noise, etc. That is a kind of aggravation or ailments from. There can be disease or the etiology from fright, grief or disappointed love, motion or from stooping the head, riding, sea traveling, and even closing eyes. These are the ailments from. And we can see the doctrine of signature, that is the animal feature being applied in the homeopathic therapeutic. So the first one is spiders are seen in constant motion until they are spinning their web. Once it is done, they don't move that frequently. Then they are waiting for the prey. So likewise, the patient is always very restless and very moving about. The spiders catch its prey in very deceptive and cunning manner. So like that, the patients are also very cunning and deceptive. And when I say this, phosphorus is not cunning and deceptive. Okay, so that is one thing you can keep in your memory. Then spider's venom action is very violent, and hence all the complaints the spider may be affected. All the complaints of the spider remedies, it also will be very violent in nature. Male spider is known to perform dance during mating season to attract females, and hence we can also see patient desire to dance, which relieves his complaints. Then common spheres of action we have in mind. So in mind, they usually produce some nervous related symptoms like anxiety, trembling, restlessness, oversensitiveness, and nervous prostration. All these symptoms we can find in phosphorus also. So the symptoms will be of case of nervous prostration. I just made it a little bit beautiful. So you can see the common symptoms the person might be feeling. And these symptoms nowadays it is very easy because of the stressful life nowadays people live. The it is very common to have this breakdown. Then in CNS, this is under remedy because we saw that the spider venom is actually neurotoxic. So we do have action on CNS, especially the motor nerves. So motor nerves are affected means the movement is affected. As a result, here it is not a paralysis, but it is involuntary jerky movements like chorea, hysteria, all those involuntary jerky movements we can see here, and also it produces hyperesthesia and convulsions. Hyperesthesia will be increased sensations and convulsions also. They have got action on CVS. The spider remedies can act on heart and blood vessels, which causes constriction. So they are good remedies for conditions in which there is hypertension is there. There may be degeneration and destruction of blood vessels. It can also act on papillary muscles of heart and producing murmurs. And when we think of phosphorus, phosphorus is also having some type of nervous degeneration. They may have involuntary movements. Anyway, they are having hyperesthesia and convulsions. And CVS also, in case of heart, they are good remedies for murmur, and they are hemorrhagic remedies actually. So causing more of a laxation in case of blood vessels. In kidney, the spider remedy it acts on kidney to produce albuminuria and hematuria, which means good remedy for glomerulonephritis. And in skin, because the venomous action, obviously it is going to produce some superficial or surface eruptions also. So in skin also we can see there will be vesicular eruptions, boils, carbuncle, etc. with burning pain. Shall I do this characteristic mental symptoms also or just stop here? What you want?
I think we can continue next class, miss.
Okay.
Okay. I've taken the
Uh,
screenshot, don't worry.
okay. So we go back. Microsoft Teams. Where is recording?